Our next speaker is an expert on the economic incentives of healthcare. For 25 years, Dr. Wendy Lynch has been making the connection between human and business performance. Her career has included roles as faculty at the University of Colorado Health Sciences Center, senior scientist at Health Decisions International, and principal and senior consultant at Mercer Human Resources Consulting. Dr. Lynch has been involved in several pivotal studies in the field of health management, productivity assessment, and human capital management. Now, as research director of an education and research foundation called the Health as Human Capital Foundation, she continues to educate audiences about economic incentives in healthcare. Author of many articles and reports, Dr. Lynch is also an author of the book Aligning Incentives, Information, and Choice, which is at your place setting. Please join me in welcoming Dr. Lynch.
Is the mic on? In the back? Can I get some waves? Thank you. Thank you for having me here. I'm very happy to be here with my friend Dee Eddington. It's a treat when we get to be in the same place at the same time. I met Dee in 1986 when my elementary school visited his lab. No, it's been a very wonderful thing to have our paths cross as long as they have. One thing that I don't put in my bio is that I am the daughter of a theoretical nuclear physicist and a biochemist and the little sister of a junior chess champion, which just means that I had no hope of having any fashion sense whatsoever. I am absolutely certain that when they map the full genome, they will discover that aptitude for math and aptitude for clothing selection are incompatible completely. So you will see me, if you ever do, speaking, and I wear black, 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 and when I really want to branch out, navy, blue. So today is a branch out day. But you would feel that way too if your father wore plaid pants and striped shirts and thought they went together. So a wonderful thing about being the daughter of a scientist or a family of scientists is that you do question a lot of things and you wonder about a lot of things and you're encouraged to do so. And I think about the same time that Dee was starting to feel depressed about the industry, somewhere around 10 years ago, I really started to wonder if we had asked the right questions about health and about health in business. And what I started to realize is that we've done a lot to question what we ought to do and how it ought to be done. But we really had done a very poor job of explaining to people why it mattered in the first place. And so I want to ask you to look at things with a different lens today. Here's an example of a company that we worked with. And for a 3-year period, they had a wonderful trend. This is their combined medical, absence, disability, and workers' comp cost. This company actually had leadership out on the speaking tour talking about how wonderful their programs were and how they were keeping people well and that it would be responsible for keeping their costs low. Think about the lens that you have when you look at healthcare costs and attribute them to well-being and health. And think about this example that we'll talk about later, where a small department changed their average absenteeism from 19 days per month to 6 days per month. And think about why that might happen. Because if you work in health promotion and human resources and you think about sick leave, you usually think about sickness. So what happened here? Usually, at least until 10 years ago, we used the following logic, and you saw this also from Dee, something similar. Essentially, it says that when you want to improve business outcomes, you do something which is usually intervene and improve employee health. That reduces costs, it saves them money. Then somewhere in the 90s, we started to say it also reduces absence, which helps you save money. Then in the early 2000s, we said it also improves presenteeism, which also saves you money. And so it's a great explanation, and it feels good, and it's a nice altruistic message. We are going to help people. Well, if you believe that keeping costs low is the result of improving health, now what do? The same people who were on the speaking tour talking about how well they had done on healthcare costs, what do they do now? What do they say? Did every single person in their company get sick on the 1st of October in 2007? What happened? And what do you say? And what do you do with the logic that said that now we're going to improve health and that reduced costs? Uh-oh. Now we're losing money. Costs went up. And what I had started to hear was, it's those employees' fault. They're not working out. They're not engaging. We're offering all these great things. They don't do them. They aren't getting good scores on their HRA. And let me tell you that while we are blaming the employees, guess what they're doing? My job is giving me migraines, high blood pressure, chest pain, and bleeding ulcers, and I'd quit, but I love their health plan. The employees are blaming the employer. The employer is blaming the employees. The real story of what happened here was the economic downturn hit this company early. After a period of really incredible growth, they realized they were going to have to downsize. What happens when employees get nervous about their jobs? What happens when they realize they're not going to get the promotion they thought they were going to get, the raise they thought they were going to get? Is that health? It certainly affects costs. Today I want to introduce you to the whole concept of human capital, and most people have heard the term, and I have to say most people have responded poorly to the term because it sounds so judgmental and widgetizing people. But let's talk about what human capital really means in the economic sense. Human capital is the set of assets, the set of potential that any individual owns and brings to the world. You are a potential made up of your skills and motivation and your health. And that potential is what you apply to the things you want to spend time and energy on. Sometimes it's what you apply to your community. Sometimes it's what you apply to your family. Sometimes it's what you apply to work. If you think of it as a personal asset, then what you realize is that each individual owns their own human capital. Nobody else can give it to them. You can't buy it. There's no way to change your human capital without you putting some effort into it. And when you use your human capital, including health, you do so because you want to exchange your human capital assets for something valuable to you. The currency, the human currency that you spend on leisure and on work, you do so because you get something useful or satisfying as a result. That is human nature. You spend time with family because it makes you feel good, or it makes you feel less guilty, depending on how the family works. But you do so because you're going to get a reward of some sort, either intrinsic or extrinsic. It's either going to be money, or it's going to be opportunity, or it's going to be recognition. You spend your currency because you get something back. So in that context, if we think about human capital and health, why should I care about my health? That's the question today. Why should I, as a worker, care?